I came to the area of concussion as a school psychologist. I was at Grandview High School. I started there in 1998. But in 2004, there was an incident where a young freshman football player named Jake Snakenberg suffered a concussion. He was cleared to go back the next week, and in the following week, in a Saturday morning football game, he took another hit to the head. He collapsed on the field and he was airlifted away. He never regained consciousness, and Jake Snakenberg died of second impact syndrome. So although legislation is about that rare incidence of second impact syndrome, concussion management now for school districts is really about helping and working together as a multidisciplinary team to help these kids get through the recovery period for concussion. The reason why we work so closely with teachers is that even though this is a medical condition, the management of the concussion really happens between the day 1 to about 3 to 4 weeks. And in that amount of time, these students are at home and they are at school. There's not a lot that the medical doctors do in terms of actually fixing this condition over those 3 to 4 weeks. So during that 3 to 4 weeks of where 80 to 90% of them will recover, there's a lot of management that is done by teachers and parents.
Hi, my name's Sherry Ballantyne Talmadge. I'm a primary care sports medicine physician, and I'm here today to give you both education and reassurance about concussion. You can get a concussion by the mechanism of injury being either directly hitting your head or indirectly with a mechanism like whiplash. So unlike a skull fracture or a brain bleed, a concussion patient's MRI will be completely normal. What a concussion needs immediately is short-term rest for the brain so it can recover from its injury.
So what's changed with this new BVSD concussion protocol? The main goal of the Brain Injury Resource Team that created the new guidelines for brain injuries is to educate everyone in the possible effects of a brain injury or concussion. With an increased understanding of the possible effects comes an increased understanding of how to help your students recover from a concussion.
What you will see are vague signs and symptoms such as headache, trouble with bright lights or loud noises.
Well, mostly headaches and mostly dizzy are the ones that you see with these symptoms. The other domain would be in the cognitive area. They have trouble remembering things, they have trouble making new memory, making new learning.
Difficulty concentrating or remembering.
Or they have slow processing speed. So you'll see that in the classroom. The other area would be in the emotional area. They are either very quick to anger, they can be very sad or very nervous, more so than they normally are. And the last area is in sleep or maintenance, and that would be that they want to sleep quite a bit or they have difficulty falling asleep and very easily fatigued. So those are the 4 symptoms, and whenever you exert the brain and you still have symptoms, then that means that there's still recovery left to go with the cells.
After the game, I kind of felt tired and I kind of had a headache, but I didn't really think it was something I needed to worry about, really.
He was definitely light sensitive and noise sensitive. It seemed like allergy symptoms to me.
When I would go to math, it was kind of looking at all like equations and looking at like numbers, and it just kind of like made my head like pound, and I didn't feel very well.
The next day, I got a headache for the entire day and could not focus in school. I just got like really emotional, which is kind of a less noticeable sign of a concussion, but I was uncontrollably crying and was just not feeling quite right.
But she had a lot of fogginess, very, very fatigued. She was noise sensitive, light sensitive, had a really hard time transitioning in the hallways.
Had no attention span, could not concentrate on anything, and was retaining nothing in school. So I would come home and just sleep, and I literally physically could not do any work because it was just too tolling on my brain.
The district's guideline for concussion management outlines the process BVSD has adopted to manage students' recovery and return to learning in the school setting. This guideline was developed using the most current national and local information and best practices for concussion management in school settings. The hallmark of this process is the use of a concussion team within each school. The team is instrumental in ensuring that timely and accurate information is shared between the student, the staff, administration, and the parents. This information exchange ensures that students are provided with the brain rest and the recovery time needed. After this video, it will be important that you learn who are the members of your concussion team and how the information will be disseminated within your school. Whether a student brings a medical note to school or just lets you know that they've had an injury, the most important and immediate thing to do is to notify the concussion team leader and your building contact. The quicker academic adjustments are implemented, the sooner we expect the student to return to learning in a normal fashion. BVSD's guideline does allow academic adjustments to be implemented without a medical diagnosis on a case-by-case basis. Because we know not all students will be seen by a healthcare provider, we have made it possible to implement academic adjustments or brain rest when symptoms are present and when there is good evidence that an injury has occurred. These situations will be evaluated by the school nurse consultant.
Steve, are you doing okay?
Yeah, I'm okay.
Are you sure? You look kind of tired. You look like you don't feel very good.
Okay. Honestly, I think I took a spill this weekend. And I hit my head and it's kind of causing a headache now, but now actually the day's going on and I'm getting sick.
Okay, you look like you're not feeling good. Why don't we go ahead and go down to the health room so they can check you out?
No, I'd rather stay here. You have homework I really want to get. I don't want to get behind on my work. I want to get this done.
Well, the best thing you can do is to rest because we don't want you to feel sick any further. And I think if you're trying to focus on your homework, that's really going to make your head hurt a lot more. So why don't you take a break for right now?
Are you sure?
Yeah, I really think you should go down to the health room and they can just check you out and see how you're doing.
Okay, yeah, I am feeling pretty sick to my stomach.
Okay. Chris, could you take him down to the health room?
Thank you.
You've already heard how the effects of a concussion can affect a student. But now we're going to talk about how you, the educator, the counselor, or the administrator can help a student in his or her recovery.
Knowing that some of the most needed and effective interventions involve rest and a slow recovery, how can we translate that into adjustments in the classroom? Some examples of how to help a student recover from a brain injury or concussion include reducing the amount of work he or she is required to complete. This could look like a complete exemption of all work, a lowered expectation, such as 50% of the originally required material, or other reductions. Sometimes healthcare providers may prescribe no work at all. These prescriptions should be followed by the school team. In other situations, a student may not come back to school with a prescription, or the prescription may say as needed, but the expectation would be that a teacher is responsive to a student's individualized needs and make adjustments based on those needs.
We expect that 80 to 90% of concussions in students will resolve if students are given early and appropriate classroom adjustments, as well as appropriate care and rest outside of school.
All of my teachers made huge accommodations for me, and not just like you can make up the work later and you don't have to worry about anything now, but they also cut the workload so much. It took a lot of stress off of me to know that I wasn't expected to make up every little thing that I missed.
There may be a situation that arises where the students and/or parents question the recommended adjustments. It is important in this situation that you allow your concussion team to be the educational experts. They can also help to recommend what you do as an educator in regards to extending the adjustments and looking at those even further.
Of course, you may be worried about students trying to work the system. In fact, you might be thinking about one particular student right now. Don't worry. What you need to do is make sure, work with the team. Find out what's reasonable and what's not reasonable. Use the teacher feedback form. And of course, consult other teachers about what's working in their classroom.
Within 3 weeks, there should be an opportunity to let the concussion team know how the student is doing in your class. Are you still needing to use some adjustments? Or is the student not needing any adjustments and appears to be back to normal? To communicate this, the teacher feedback form will be used. The more participation by teachers in using this form, the better picture your concussion team will have of this student's recovery and how to best move forward.
So overall, concussion is a serious injury. However, with a proper team in place, we feel confident that we have given you the educational tools and resources to handle this injury more successfully.